Hey, what's up, guys? So today I just want to talk to you about the new hip precautions that have kind of been in place for the last year or so. So there's some new research that came out not too long ago, just saying that the standard posterior hip precautions aren't as important as we thought they were. And this is kind of old research, but it's kind of been revamped just recently. So this was actually discussed at a recent conference in Vegas with a bunch of orthopedic surgeons. So the article kind of explains that the latest advancements in hip surgery are just kind of saying you don't need to have these like huge hip precautions, and that you can have instead minimal hip precautions to kind of replace the standard hip precautions for posterior hips. Now, this is probably not going to work for every surgeon because maybe some surgeons still do hips an older way, but this is probably since the 80s. They've had these new techniques in doing hip surgeries and new hardware and stuff that's supposed to just make hip surgeries a lot better. So anyway, today I'm just going to kind of talk about what you can do as an occupational or physical therapist to implement these minimal hip precautions in your treatment protocol with your patients. And this is definitely something you want to discuss with the doctor before implementing these precautions, because most doctors are familiar with the old hip precautions, which are don't bend more than 90 degrees, don't internally externally rotate, don't pigeon toe, and I feel like if you can implement this precaution, these minimal precautions, you're gonna get your patient a lot more independent, a lot quicker, and you're gonna be able to build their confidence a lot quicker as well. So, what is the new hip protocol for physical and occupational therapy? Dr. Sulko, who's the main person in this research, has kind of said that minimizing precautions and simplifying post-operative recovery is part of the larger simplification of surgery, where we are using more selected resources and interventions for people instead of blanketing everyone with the same kind of protocols. And so these new hip guidelines are probably not for everyone, especially for those who are at high risk for dislocation. And so what he's just kind of saying is that you need to be more specific towards your patient. If you think they're at high risk, then you probably need to have standard hip precautions. But for the majority of your patients, you should be able to skip the regular hip precautions and just avoid those extreme positions, such as bending more than 90 degrees in combination with internal rotation. So if you look at the link below, I actually provided on my website a link to the actual protocol that you can download and use in your practice after you definitely clear this with your doctor. And so let's just talk about standard hip precautions versus minimal hip precautions. So, as per the evidence, the reasons why minimal posterior hip precautions are used are because the current standard posterior hip precautions are based on precautions from 25 years ago. That's crazy, right? 25 years ago, we've been using these hip precautions, and we haven't really made any new changes on this. The current quality of the soft tissue repair and closure is now much more robust than it was in years past. And that's why they're saying that we can start doing these minimal hip precautions rather than the standard hip precautions. And another reason we can start using these minimal hip precautions is because there's a lot more surgeons today that have extensive experience doing this new hip protocol, these new hip replacements. And evidence shows that experienced surgeons, which is more than like 15 years of experience, are going to have decreased rates of hip dislocations. So I feel like that's definitely a factor too. You want like experienced surgeons that are using these protocols. Someone who's been practicing for over 15 years, probably, because that would be someone who's more experienced. And then just they're experienced also with the latest techniques for hip surgeries. Also, another thing is it's more common to use a large diameter for femoral head, which is actually 28 millimeters now. And there's a concern related to standard precautions using patient fear, sleep, dissatisfaction, and these patients tend to be less active, which can hamper recovery. So these are the reasons why we should start moving away from standard precautions to these new minimal hip precautions. And then also minimal precautions have shown the same or less dislocation rates in patients without risk factors. So for your standard, your regular patient that's going for an elective hip surgery, we're finding that the rate of dislocation is about the same as other patients or less. Standard hip precautions are no pigeon toe, no bending more than 90 degrees, no internally or externally rotating. Mostly internally rotating can cause dislocation, but the new minimal precautions are pretty much saying that you can do whatever you want, but don't have those combined movements. So the number one thing is do not bend more than 90 degrees and internally rotate. And a good example of this is just think of someone when they get off the toilet, if they're bending more than 90 degrees and maybe they're internally rotating their leg or their hip to stand up, that could be something that you kind of educate your client on, educating them on proper medical equipment, maybe having just like a taller seat, an elevated toilet seat, or a bedside commode, so they don't have to bend forward so far. And then another thing is just another idea to kind of help you understand the minimal precautions is you wouldn't want someone to, like, if they were shaving their legs, they would have to bend more than 90 degrees and they would probably internally rotate to be able to shave the outside of their leg. And that's just another thing that you would educate your client on. And I have a whole, a list of things that you can look at for this. Definitely look at the link below. I have an article that talks more about this and just a protocol that you can use in your hospital or rehab or anything else, just to kind of give you some guidelines on how to go forward with this protocol. All right, guys, I hope you enjoyed this video. Definitely like, subscribe, and leave your comments below. Like, what do you think about these new minimal precautions? Do you think, like, is this going to be effective? Is this something that we can get out to the masses? What do you think your surgeons would think about this protocol? Is that something that they would consider in your practice? And thanks for watching, and I'll see you in the next one.